morning, good afternoon, or good evening, depending on where you're joining us today for this most important webinar, Transforming Pharmacy Practice for Improved Care and Management of Diabetes. My name is Paul Sinclair. I'm the chair of the FIP Board of Pharmaceutical Practice. I'm a practicing community pharmacist from Sydney, Australia, and I'm a past president of the community pharmacy section of FIP. And it's my great pleasure to be moderating today's event. And I look forward to your involvement in this event. And we have a very, very high quality lineup of presenters and panelists for you today. If we move to the next slide, please. As I mentioned, we are very privileged to have an exceptional lineup of panelists and presenters, and I thank them all for their commitment to our Transforming Pharmacy Practice program. Before we start, a few housekeeping matters. I just let you know that the webinar is being recorded and live streamed via YouTube. This recording will be available on our website at events.fip.org. You may ask questions during the course of this webinar, and I would ask you to use the question box, the Q&A box provided on your browser or on your screen. You are welcome to provide feedback about the webinar at webinars.fip.org. We welcome all constructive feedback because we strive to provide the highest possible quality digital content for our participants. We would encourage everyone to become an individual member at FIP. This can be done at fip.org/membership registration. This will open a suite of benefits, member benefits to you, and will also introduce you to a global community of pharmacists. So we would welcome your individual membership of FIP. Thank you. The next slide, please. Today's presentation is centered on the FIP development goal number 15, which is people-centered care. The FIP development goals align with FIP's mission to support global health by enabling the advancement of pharmaceutical practice, sciences, and education. The learning objectives from today's webinar on the next slide. We'll see them there to identify the challenges and opportunities for pharmacists in addressing diabetes, to recognise the different ways pharmacists can advocate for increased recognition and visibility of roles in providing diabetes services, and to understand how the role of pharmacists can be elevated in achieving global diabetes goals through the FIP Practice Transformation Program on Diabetes in commemoration of the 2021 World Diabetes Day, which is this Sunday, the 14th of November. And the theme for World Diabetes Day this year is access to diabetes care, which ties in nicely with our program today. A quick overview of today's program is on the screen. The duration is 2 hours. We have a very full agenda, and as I mentioned earlier, some excellent presentations and panelists. The Practice Transformation Program on Diabetes is a flagship program designed and delivered by FIP in line with the Federation's goal to support the transformation of pharmacy practice, sciences, and education workforce towards improved patient care and the achievement of universal health coverage in the FIP development goals. The program aims to deliver FIP's commitment to the WHO's Astana Declaration and to the primary healthcare agenda. A key aim of the Practice Transformation Program on Diabetes is to provide strategic support to FIP member organisations, and particularly those from low and middle income countries, to develop and implement pharmacy services that can have a sustained positive impact in the prevention, screening, management, and treatment optimisation of diabetes for improved patient outcomes. Next slide, please. It's now my pleasure to introduce each of our panelists. And our first panelist is Dr. Irina Blazenko, the Vice President of the International Diabetes Federation. Irina is a member of the European Medicine Agency Working Party with Patients and Consumers. She's a member, representative of the PCWP EMA steering group of the European Network of Centres for Pharmacoepidemiology and Pharmacovigilance. She's the responsible scientific editor for the Pharmaceutical Journal of the Ukraine. And Dr. Irina is an international expert in diabetes. She has taken part in the development of regulatory documents, medical standards, etc., on national and international levels. Dr. Irina participated in many meetings with government and other key stakeholders and has attended many international congresses with a view to raising awareness of diabetes and affecting policy changes. Our next panelist is Tolu Oshibasan from the Advocacy and Partnerships Office with the NCD Alliance, the Non-Communicable Disease Alliance. Tolu joined the team in Geneva in 2019 to further develop the NCD Alliance's strategic relations with the WHO, United Nations agencies and member state missions. She's also supporting the development of the NCD Alliance membership and partnerships across civil society, the private sector and academia. Before joining the NCD Alliance, she worked in both the public and private health sectors in Nigeria. Her most recent role was with the Secretariat of the United Nations Interagency Task Force for Non-Communicable Diseases. Tolu is a pharmacist by training and has just completed a master's degree in public health from the London School of Hygiene and Tropical Medicine. She also serves on the board of the African Forum for Primary Care, a civil society organisation that consists of diverse multidisciplinary primary healthcare workforce stakeholders from across Africa, with a shared vision for primary healthcare delivery that is comprehensive, accessible, of high quality and responsive and delivered by an empowered healthcare team. Our next presenter or panelist is Mr. Michael Donghue. Michael is a global patient advocate from the A1C Wellness Diabetes Organisation. Michael defines himself as a global advocate, a patient leader, and always a promoter, a storyteller, a teacher, a lobbyist and activist, and most of all, a person who seeks action and change, especially in the areas of diabetes and NCDs. He is the founder of A1C Wellness Diabetes, an organisation whose mission is to improve the outcomes of individuals living with, caring for, and treating diabetes patients by increasing advocacy, awareness, and education throughout the globe. A1C Wellness Diabetes offers the best practices in program project management, marketing and communications, as well as policy development and lobbying through a deep knowledge in diabetes, complications, and related chronic illnesses. Their goal is to create and deliver relevant messaging for those who live with diabetes or within the healthcare professional audience through an integrated set of historically effective new communication tactics, including digital, video, event, print presentation, and other recommended delivery methods. Welcome to each of our panelists today, and I thank you for your participation in this important forum today. We have a number of questions which I will direct towards our panelists, and that will take the form of a discussion where they will impart their expert views, and hopefully for our participants today in the audience, they will be able to show through their experience how diabetes management can be best affected by the pharmacist. So I think in the first instance, I will start with Irina, and then I will ask Tolu for her thoughts on this question. And the first question to Irina is, diabetes is a very prevalent condition, with cases projected to rise from 463 million in 2019 to more than 700 million by 2045. With such a huge burden expected to impact health systems and patients' lives in the near future, one could say or would say that there could be more work done in terms of prevention. What strategies could be more effective in terms of prevention of diabetes and risk factor modification? Irina.
Thank you, Paul, for questions. It's big question with many aspects. I would I see the use data from IDF last at the IDF Diabetes Atlas, which have new data, how many people with diabetes, which is big problem and pandemic. And for the start question, answer for question, I would like to underline about new documents who will launch in this year, WHO, it's Global Diabetes Compact, to speed up action to tackle diabetes. This is a big event for launch, and the main goals for this and vision to reduce the risk of diabetes and ensure that all people diagnosed with diabetes have access to quality care and treatment, what is equitable, comprehensive and affordable. And this is most important that big attention or support country is implementing cost-effective programs for the prevention and control of diabetes. This is include reducing risk factors through the multi-sectoral population-based health policy and strengthens primary health care to timely diabetes diagnosis and treatment, prioritizing vulnerable population living with diabetes. In this case, protect, detect, treat, and recover. And in every point, our pharmacists also. And there also a resolution of WHO from May of 2021. It's reducing the budget of non-communicable disease through the strengthened prevention and control of diabetes. And what we can do with this, promote awareness about diabetes, promote lifestyle changing, people access to, this is many aspects. It's not only medical aspects. This is also access to physical activity, campaign in media for promotion, health style, patient education, affordable and adequate appropriate care. Because we know many studies show that from different parts of the world have established that lifestyle modification with physical activity and or health diet can delay or prevent onset of type 2 diabetes. Only weight loss 5-7% achieved by reducing calorie and increasing physical activity, reduce incidence of type 2 diabetes 58%. And the IDF recommends physical activity 3-5 days a week, but for minimum 30-45 minutes. But I want to underline the early in life, when eating and physical activity habits are established, and when the long-term regulation of energy balance may be programmed, there is an especially critical window to prevent the development of overweight and reduce risk of type 2 diabetes. IDF, of course, recommendation healthy diet. We know this, and we launch these books about diet. You can see this. And also, last point is like IDF framework for action on sugar, that IDF support WHO conditional recommendation to reduce recommended sugar intake to 5% of daily energy intake. This is because it's related with behavior and related with risk of type 2 diabetes. Thank you.
Thank you, Irina. And some very easy to implement strategies there, particularly around trying to get habits of physical activity, okay, and changes in lifestyle. The earlier the better. So as soon as that's entrenched in your daily routine or your weekly routine, the better. Tolu, I'll come to you now. And what are your thoughts regarding what strategies could be more effective in terms of prevention of diabetes and risk factor modification. Tolu.
Thank you very much, Paul. I would take the opportunity to thank the FIP for inviting me to speak again. It's always a pleasure, and I'm happy to be here. And it's great to see participation from all around the world, from my home country, Nigeria, and I think from my alma mater, the University of Ibadan. So I thank you very much for giving me the platform. And it's great to be here with the other distinguished panelists. I would say a few things to complement what Irina has very well articulated. The burden of diabetes is rising globally, and according to the latest data from IDF, which was released in a very timely manner this week, we understand that there are now 537 million adults. That is 1 in 5 adults has diabetes. And like you said, we need to begin to consider more effective approaches, strategies to ensure that prevention is effective. In my own understanding, prevention can be discussed from 2 different angles. There's what we know as the population-based dimension, where we look at the role of government and the role of the whole of society in tackling the risk factors for diabetes. And under that category, we can look at health promotion, making sure that environments are safe for physical activity, making sure that people can go out, stay active in a safe manner, and making sure that children, adolescents, and adults are protected from the harmful influence of industries that make unhealthy commodities. So for that dimension, we know that there's a need for all of society collaboration. It's not just something that governments would lead. And if we're looking at promoting efficiency in preventing diabetes, we need to focus on the role of the different sectors of government, agriculture, commerce, sales, even labor, people that do labor policies, because the role of physical wellness and at the workplace is also very critical. It could be a driver for NCDs, including diabetes. So there's that dimension that looks at the population as a whole, and how we can more effectively protect them from diabetes. Moving away from the population-based dimension, there's the individual-based dimension of for preventing diabetes, where we look at high-risk patients, those who have a history of diabetes in their family, those who sort of come down with diabetes while they are pregnant. And it's important for us as professionals to understand the risk that these people are at and support them through opportunistic screening, through adequate counseling, through information that can help them to take care of themselves. It's important for us to recognize the efficient processes, efficient ways to better equip them for what they are managing or coping with, or what they are at risk at. I'll probably round up by saying that I know that for diabetes as well as for many chronic conditions, many of the risks is actually starts from before a child is given birth to. For example, gestational diabetes has some impact on an unborn child. So we also need to understand the dimension of the life course approach. If someone is at risk, what are the things that should be done before a child is born? What are the things that should be done when a child is born? What are the things we should watch out for as a child grows? This goes on and on into adulthood, and then in older ages. So in my own perspective, we need to look at the population-based dimension, the individual-based dimension, building efficiency into them through effective partnerships, promoting a whole of government, a whole of society response. And we also need to adopt the life course lens to anything we roll out in terms of prevention. Thank you.
Thank you, Tolu. And interesting that you bring up the role of government in developing appropriate health policy and the support that they can responsibly give to their community. And also the notion of decisions made by parents along the child's journey from infant to adulthood. That will have a huge impact on the health and well-being of that child. Thank you. That's a really great insight. Thank you. My next question, and we'll start with Michael Donghue, and then we'll come back to Tolu. Michael, the use of point of care testing can provide a first contact point with the healthcare system for many undiagnosed patients. How do you see the added value of pharmacists in the screening of patients with diabetes in contributing to early diagnosis and more efficient healthcare systems? Michael.
Good morning, everybody, and thank you for taking the time to be on all over the world. Been watching the chat here, and it's great. The role of the pharmacist, in my opinion, from what I can see, and also I can make it very personal, is that the pharmacist is usually the easiest point of contact, as well as the most personal point of contact with the patient, as well as somebody who may need to be screened. It appears here in the United States, the pharmacists have been given much more flexibility in order to help and assist. Also, many of the pharmacies have also stepped into either a clinic level or providing other healthcare services. So to answer it in short, yes, absolutely. I would think I see my pharmacist at least once a week. I see my doctor once a quarter. So it's, and that's nothing against my doctors, because I see the cardiologist twice a year and the kidney doctor once a year. So that's exactly it. My pharmacist knows me by name. He knows the meds I'm on, and it's very interesting. He'll question, where my blood sugars are, which is kind of interesting because, he doesn't even look at the system, and I'm in a very busy pharmacy. So I really do believe this program that FIP is looking to roll out here, as well as I would hope the in-nation organizations can align, would allow the pharmacists to provide pre-screening and some immediate advice as well. Because the one thing I think I'll add into this is that more than once I've seen somebody who's been diagnosed with diabetes, and usually there's either high blood pressure or some other chronic condition, or for me, I also deal with diabetic retinopathy and DPN. The thing is, you get these diagnoses and you're not really prepared for them. And I think COVID has helped really express, I never added into my NCDs, but I also live with general anxiety disorder and ADD, and they have never been so amplified than over the last 2 years. So it is important. And I think it's interesting you had mentioned that. The other thing is, with the role of government and also us teaching younger folk on how to live a healthier lifestyle, both physically and through nutrition, it will cut it down. The awareness will increase, and they're key items. But the numbers, I know with the Diabetes Atlas, I've seen some of the new numbers that have come out, and it's astonishing. And again, that's from a lay person here. I do not have a medical degree. So, yep, I do agree. I think a pharmacist can take such a lead role in this as needed, especially when they see for a whole slew of other reasons.
So, Michael, just a follow-up question, if I may.
Sure.
From your perspective as an advocate, do you think health systems leverage the accessibility and availability of pharmacists enough?
No.
Okay.
Not at all.
And should that be addressed via health policy?
It may be one of the ways, and I think it is a country by country issue. And here in the United States, it's a country then state issue because sometimes policy is conflicting with each other. So yes, I think it is something that should be provided at the national level and supported at the association level as well. And the one thing, just to throw this out, is sometimes you'll see the National Institute of Health come out with some great information, yet it is not picked up by other associations here. And it's important. I do think there's a problem sometimes with the communication flow. So I think an event like this is very positive in order to express the importance of the role.
Thank you very much. Tolu, I'll come to you now. And how do you see the added value of pharmacists in the screening of patients with diabetes in contributing to early diagnosis and more efficient healthcare systems?
Thank you very much. I think that's a very interesting and relevant question. From my years of practice in Nigeria, I recall that one of the major challenges we we see is that patients present too late when complications are already advanced, and there's very little opportunity to do something impactful, unfortunately. So for some patients that they already have complications. And I think it's unfortunate because we understand from studies and from knowledge out there that before a diagnosis of diabetes is made, there's a window, there's a couple of years where patients have a few symptoms and they present at the hospital or at the pharmacy with this complaint. I think that this is a critical window where we can actually act as pharmacists to support those who are at risk or who might have come down with diabetes for one reason or the other. That is the window where we can sort of roll out all we know in terms of prevention, physical activity, healthy diet, and just being more health conscious. That is the window for us to scale up action and pick more people before they transit into that stage where complications have set in. And of course, it makes economic sense because eventually they don't end up at a stage where we need like a team of multidisciplinary practitioners working on them, tackling kidney issues, tackling eye conditions, tackling nephropathy. There's still a chance to bring them back to a healthy journey, with little resources. So I think that pharmacists could play a critical role, in making sure that we have early diagnosis and we can better support patients, particularly in low and middle income countries where we know that many patients, are not very health conscious. They don't know what they have. They just know they are not feeling okay. So it's important for us to be proactive, and recognize the opportunity we have, when we engage with patients to pick these conditions at an early stage and support them to get better outcomes. Thank you.
Thank you, Tolu. And of course, simple point of care testing can be a very cost efficient intervention, particularly with respect to that before complications and early in the disease state process. So I think that is most important. Thank you for that. My next question will start with Michael. And I would ask you, Michael, people living with diabetes may have complex treatment regimes and they benefit from support with strategies from improving adherence or to use insulin injectors or glycemia monitoring devices, for example. What roles do you think pharmacists can play in supporting the treatment optimization for people living with diabetes, and what services would you find most valuable from them? Particularly as from your perspective as both a consumer and an advocate.
A question like that is great, but I know it's also difficult because of, with the IDF theme or the World Diabetes Day theme of access to care, that's a health equity issue a lot of times. And I know you've got to look at it because, again, the pharmacist may be the person who's right there in the community. So I have been very fortunate to see, and speaking with a number of people around the world, that the pharmacists actually take the time to understand, obviously, not just the interactions of medicines and insulin and things like that, but understand the best uses of continuous glucose monitors. That's always key. Accessibility. I had an issue, let's just put it this way. I had an issue with one of my CGM sensors, and it was great in speaking because that becomes a manufacturer issue between the patient and the manufacturer. My pharmacist gave me the direction on what I needed to do, which is funny because I used to work in the pharmaceutical industry myself. So, but it was great that they had an understanding of this person from head to toe. And I do, being a type 2 insulin and CGM is not always in the norm, but these tools are what really have helped me since I do deal with a number of complications and conditions. But I do think it's important because the one thing I don't even know if there are the skills is you look at the T1 community and the amazement that I watch between the looping of the different systems and how they get their insulin pumps to work. And I've asked that question of my pharmacist as well. He has a lot of knowledge of Dexcom. I'm not trying to name drop anything, but it's just an example. He has a lot of knowledge on how to use those pumps, and I did not expect that. That was a recent thing. So I do believe that with the pharmacist, having that opportunity to also, they are able to look at the picture, the bigger picture of what the patient is ingesting into their system. I think one of the things that was really important for me, as well as there is a medication routine, you need to understand the whens and what is the best time to take certain medications. And even though I have a knowledge of that, it seems like every few months I need to take a step back, look at the meds, go into my pharmacist and say, should it be this, this, or this? I usually talk to my pharmacist a couple weeks before I see my primary care physician as well. So I think the role is, it has not even been touched yet. And it's not that we're trying to make a pharmacist have more work. I think it's more the opposite, giving them the flexibility and the freedom in order to really help a patient. One more comment, and I'll give up the floor here, is that window that was discussed earlier. I think that is a great point. I missed that window and I went crashing beyond it. And that's part of the reason why I'm a diabetes advocate, because you can see it coming. There are a number of factors that an individual will have if they're expressing, communicating, or even more so, someone asking, that will prevent these issues and is a huge economic savings as well. That was something that I think we always forget, and that government officials. You want to save money and reduce healthcare? Put in preventative programs.
Correct. Yes, thank you, Michael. That's some great insights there. Irina, your thoughts on what roles do you think the pharmacists can play in supporting the treatment optimization for people living with diabetes, and what services would you find most valuable from a pharmacist?
Thank you, Paul. I agree absolutely with Michael what they say, and it's great role pharmacists. And if we speak about CGM, I'm not sure that many pharmacists have knowledge for this. Unfortunately, maybe it's the next step. I think it's even not many doctors can very awareness about how manage CGM. But this is like, I think it's next step. I'm very practical. I work in pharmacy. I know that it's not necessary expect too much, but in same time we must educate the pharmacists for good support, assistance from assistance to patients. Because many diabetic patients, principally elderly, do not achieve adequate diagnosis control, disease control. Who can help? As Michael said, I see only one time per year my doctor, and very often pharmacists. And pharmacists not only must support, this is pharmaceutical care, this is responsible provision of drug therapy, which must deliver pharmacy. And that he can educate patients about the proper use of medicine. Sometimes I often speak with a patient as pharmacist. Do you know how to use this? Answer, not sure. This case, we must help them. We must make point which goals for this, and monitoring how help to during this treatment, and make especially point this time you must go to doctor immediately. Sometimes if we speak about a complication like problem with feet, this is big problem, and sometimes pharmacists give only medicine for this, but this is not right. Must be quickly go to doctor, and this is very important. Make in time do this consultation, and same time pharmacists also speak with patient and can motivate patient for achievement goals. These good words help even sometimes better than a good consultation. If we speak about concrete example, for example, IDF Europe, we make some position statement about storage insulin, and if you find new aspect with how to storage insulin in domestic fridge, it's a lot of nuance. Pharmacists must know and deliver this information, and also very important, provide information about self-management control and continue monitoring glucose level. This is most important because prevention of the diabetes, prevention of complications, this is most and cost-effective way. What we can do, of course, deliver a glucometer and other supplies, and support information that is better do now use money for this than after use money for complication, for treatment complication. Thank you.
Thank you, Irina. And I note particularly your comment about people trust their pharmacist. And it's easy for the pharmacist to start that conversation with patients because they have a pre-existing relationship with them based on knowing them for many years and trusting them. So that's very important. I do note we have a couple of questions in the Q&A, and I would encourage any of the participants here with us tonight to just type a question in the Q&A, and we will address those after our panel discussion. The next question, and I'll come straight back to Irina here while she's has the stage. And Irina, I'd ask you, what role do you think technology can play in the management and the self-management of diabetes, ranging from e-health, such as remote consultations with healthcare providers, reminders, etc., to mHealth or apps, but also in terms of monitoring devices? Your thoughts?
Great question, Paul. Very, very important now, especially now. Could you show my slides?
Yes.
That we use now, it's very popular. mHealth, it's very popular. We listen from every conference. Why? Because more than 85% world population use mobile phone, and mobile technology holds great promise to transform healthcare organization by bringing clinical workflow, patient results, and healthcare delivery to the point of care. Use mHealth application, multimedia, short messages, service, texting is effective and acceptable methods for lifestyle modification, improving medication adherence, and self-monitoring of blood glucose and other diabetes-related behavior. Mobile phone intervention may be more effective due to convenience, increased contact with intervention, and cues and feedback provided through the phone. The use of mobile technology will reduce the cost associated with the inaccessibility of medical care and reduce the cost of repeated hospitalization by 75%. Look at this. And if you, next slide, please. If you look which area we can use mobile technology or internet technology for blood glucose monitoring, data-driven prescribing, exercise and weight tracking and engagement, remote monitoring, diabetes forum and social group. We maybe a little bit lost influence of patient organization and influence peer-to-peer education that people who has diabetes can explain maybe more simple way how to manage this, and medication, food loading, and many points for influence on diabetes management. But in same times, we must remember that now I find a lot of research that show that you use telemedicine in diabetes. We can limit it some groups, for example, other elderly people who have not access to internet or something like that. and availability of potential technical problem and regulatory issue. In this case, we must also remember this about this group and not missing this group. Thank you. Oh.
Thank you, Irina. Michael, I'd be very interested to hear your thoughts from someone who is part of the system. You said that continuous glucose monitoring, you're part of that process. The role of technology, surely it must become a greater and greater part of the healthcare system.
Yes, it's become a very important part of the healthcare system, and it's funny how you can still run into some serious gaps. I think the one comment, Irina, you said that was so important was also looking towards, we do have a senior population, and I know with my own mother, she has an iPhone, has no idea how to use it, and trying to teach her how to use her EHR on her tablet is, I get a call about that over the last 2 years consistently. So the thing with using Ehealth, I think what's important is right now I walk around with a sensor for my CGM. I handle all my pharmaceutical orders and checks on my app on the phone. Obviously, I've used telehealth either on the computer or directly on the phone. The key thing is, having worked in telecom, like I said, within healthcare for a number of years and even developed apps, the key thing is we know some really important things, that physicians primarily use iPhones. We know that in developing apps, you have to make sure you understand specifically which apps are strongest within certain areas. And I think even more importantly, and there is not a very good way. I loved your slide, Irina, because it really did. If you take all those complexities and then you put it in the mind of somebody with diabetes, it could be overwhelming. So there is something that needs to be, I don't think it needs to be streamlined, but I think the circle was a great example, because I keep on waiting for my CGM. They have not approved the app for my CGM on my phone yet. But for me to centralize that with my fitness program, centralize that with my program with the pharmacy, that with my electronic health record. Right now, I think there's about 8 or 9 apps I use in order to track my health. And there's many times I will just have to put it down, focus on me, make sure I'm doing the things I need to do. Because I do have, the thing is, this phone cannot control my situation. The diabetes is still my job. The thing is taking those technologies and making them work for yourself. So, and I think that's important within the healthcare professional community. And I do believe that honestly, the pharmacist is the one who has the most time because they also have a tendency to have a few staff members that can help do some front end assistance, preparation like that. So yeah, I think that slide is still blowing my mind a little bit, but it's so true. There's just, and those are only the factors electronically. Just look at the other daily factors that are in our lives. So, but I think it over time will work much better. And also country adoption and approval is key to making it work, as well as integrating these systems into more of a single point of entry.
Thank you, Michael. So you view that technology will actually empower patients to take more control of their disease state?
Over time, yes. Right now, it depends on how they use it.
Yep. Thank you so much. My next question, I will direct firstly to Tolu, and we'll consider patients living with diabetes can develop complications such as retinopathy, nephropathy, and diabetic foot-related conditions, all of which we see during the progression of that disease state. I have 2 questions related to this. How do you think pharmacists can contribute in terms of the prevention and management of diabetes complications? And how can interprofessional collaboration between healthcare professionals be enhanced in terms of referral and management of these complications? So there's a fair bit there. Tolu, your thoughts?
Yep, thank you very much for that question. I think the first entry point for pharmacists to better support patients and, in terms of prevention and managing diabetes complications is to, first of all, have a thorough understanding of diabetes, the comorbidities, and the complications that are well documented to exist with it. So, if you have someone who is living with diabetes, you know that they are at the risk of a couple of conditions. You've mentioned them. And I think we also should understand some of the things that they would need in their care journey. For example, I have listed here just on my paper, there's the role of self-management to monitor blood sugar. There's the role of yearly lipid profile, lipid control, which might require medications, depending on how the disease is progressing. There's the role of self-management for foot care. There's a role of annual health exam and screening for nephropathy. So these are some of the things that we should have at the back of our mind as the basic needs that some patients would need, depending on where they are with their management. And I think we're very well placed to recommend them to patients. Now, this comes with a couple of complications, if I may put it that way, because what pharmacists are recognized as, for our expertise in counseling on medication, in some settings, clients might actually wonder if, you have that right to recommend those tests, particularly if they are hearing it about them for the first time from you. And I think that sort of leads me to your point on interprofessional collaboration. We have to ensure a system where we are friendly enough with other providers to engage with them, to suggest to them some of the trends we are seeing in our patients, and how we think we can better protect them, to make sure that the complications are delayed as much as possible or even prevented where possible. Apart from interprofessional collaboration, some of these things would need systematic changes in legislation. There will be need for training amongst ourselves as pharmacists. There will be need for funding. I mean, if we are looking to develop ourselves in these different areas, there are training needs that have cost requirements, if I may put it that way. And I'm happy that this is an area that the FIP is looking into. So while we are looking at the role of the pharmacist, we should also deepen our knowledge on the comorbidities, the complications that they are at risk at, and how to guide patients through the system, through collaboration, through interprofessional collaboration, and partnership with all the other stakeholders to make sure that we can guide patients appropriately throughout their journey. Thank you.
Thank you, Tolu. Michael, those complications we mentioned, such as diabetic foot conditions, can have a dramatic impact on quality of life.
Yes.
And pharmacists surely are well positioned to identify those early in the disease progression. How else can those quite debilitating complications, how else can pharmacists be part of that, the care process with that and the identification process?
It's interesting because I think Tolu made a very good point that these individuals have that power and have that, if they take that protective authority over the individuals, it does help. In discussing DPN or DR, or even more so foot issues, the foot issues are something that I think are key, because it's very easy for, let's say, to identify any wounds that are not being properly taken care of. It's also not fairly easy to do a filament test to see if somebody has the response or reaction and should be getting into a podiatrist or back to their PCP. So I would say it's a communication thing, which is really important, because I do know, and it's so funny, my pharmacist is the one I keep tagging back to, and that I want you to know that makes it very personal to me. And he does ask me if there's a medicine change. He doesn't have any focus on what is in my health record due to privacy. But yet, if you see a certain drug double in the amount, let's say metformin goes from 1,000 to 2,000 milligrams. The challenge with that is basically means Where's your blood sugar at? Wait, you've had high blood sugars for how long? And they know us. They really do know the individual. And I think it's key to give the ability to ask the questions, even sometimes beyond the medications. I think it's funny how I see people leave with in the United States, they leave with their meds and let's say a big bag of chips or some beer or something. It's very interesting because the care is not balanced. So I think the one I question in my mind is DR, but I think that's a great question because there are certain things, even sitting here looking at the screen right now, I can tell when my blood sugars are high or low. So it's important for the pharmacist to be given the skills and the empowerment. And I know that's kind of a repetition of earlier, but they are so key in the daily health. And I think I was very excited when I heard about this event because I've always felt this was a missing link in my healthcare. And I always think about my healthcare team. And I have my healthcare team, and then my pharmacist is about 4 steps over to the right because his communication is basically just getting a prescription refilled, then having a conversation with the doctor if necessary, even through a note. So there are many, and the other thing is many conditions can be identified through that one-on-one touch. And with the pharmacist is usually looking almost eye to eye with me from about 3 feet away, even in the days of COVID. And there's so much that can be said if a question is asked, if they can do that. And if there are, he again identify through the medications you're in to make sure things are going okay.
Thank you, Michael. I must say, I wish all my diabetic patients were as well informed and as eager to be take ownership of their health outcomes as you are. And you clearly have a very interactive and engaged pharmacist in your healthcare. That's great. So I'll just a couple more questions, and I'll start with Tolu here. FIP is working on a practice transformation program aiming at achieving sustainable impact at local level in terms of diabetes prevention and care through pharmacists. This will involve the training of the pharmacy workforce, the delivery of diabetes-related interventions, and the monitoring of their impact. What would be your #1 recommendation for the success of a program like this? What would success look like for this program? Tolu.
Thank you very much. I actually have a couple of recommendations. I hope that's permissible. And one of the things that came to mind was the role that communities and people living with would play in such a program. I mean, there's this phrase that I'm sure we're all familiar with. You can't do anything. There's nothing for us without us, basically. So if we're looking to develop a program that can empower pharmacists to improve on care for people living with diabetes, I think that we should find a way to build a program that puts patients at the center and consults with them, collates their views and voices and some of the challenges they have and the changes they would like to see. I think that would be a way to make sure that we're developing something that is strategic and able to meet them at their greatest point of need. And I mean, this is a global tool. So I'm looking at a global level consultation as well, bringing in different patients from different parts of the world to share their views, to share some of the things that they would like to see in such a transformational program. So that's one of the things I wanted to share with us. I also wanted to mention that I'm almost sure that this is already been considered. Such a program must be available in different languages because we're from different parts of the world, from different regions, and not everybody is familiar with the use of English language. So we must make sure that we have a language that can serve each of the regions and something that they can engage with easily. And finally, we must allow such programs to be adaptable for the context at the country level. we know that, apart from some of the common factors that we know that drive chronic conditions like NCDs and diabetes, there's some cultural context, there's some social context that make disease management more difficult in some settings than others. There are some countries where for their festivals, what they use is sweets, candies, alcohol. These are things that are rooted in their way of life. So while we work on such global tools, we must allow countries the opportunity to introduce the context in which practice is rolled out, and implement the different things that they would need to bring on board to make such tools relevant and adaptable to the communities they serve. So those were the points that I wanted to share with us. Thank you.
Thank you, Tolu. And we'll see a couple of those tools will be launched later in this program for the benefit of member organisation and pharmacists. Michael, I'd be keen to just get your thoughts on that. The number one recommendation for success, and clearly you're part of a successful program with your pharmacists, but in the broader sense of this practice transformation program, what would success best look like across the board?
I think success for a pharmacist, for me, success would be seeing my medication doses go down, reduction in those medications, including insulin, as well as metformin, et cetera. I think most of all, though, it's a communication thing, and really asking that question and having the right to keep that information. If they say, "How are you doing? I see that you take this medication for your high triglycerides," which is a major issue for me. It's something to say, "Are you following through with the diet plan that you need to follow through with?" And that is always the hope that I'm doing the things. Am I exercising the way I need to? My feet, I'm on a medication for the DPN, and I would have to say that's the one medication I cannot live without. I go about 12 hours without it, and I do have a podiatrist that the system of how he prescribes sometimes can be delayed, and that's something my pharmacist is aware of. So there's a window that you can only get this medicine within from the time of your last prescription until the next one. It's usually within a 2-day period. So you really have to time it very carefully. So I would say the thing is with the pharmacist is that there is very much a personal spot. And I do believe that, that due to certain local regulations and policies, the pharmacist can be limited in their ability to ask and check. I think that they should have the same, basically, I'll say same basic privacy opportunities that a physician does, because that they're a registered healthcare professional within their state or country, and they understand the ethics. I'm sure FIP has a set of ethics and expectations of their members, and I think that is something that will align well when you roll out this program. So I hope there's a more of an adoption, and it is something even for myself I do see should be brought up higher onto my own list of lobbying efforts in order to make change. And that's one of my hopes. So yeah, I don't mind my pharmacist asking me any question, and I think it's important. I do believe that drug profile does speak a lot, as well as looking at the physical person.
Yep, thank you. And certainly in any marketplace, issues around access to information, patient information, if there isn't a shared platform, that can only hinder the process of healthcare. And in so many places that those platforms aren't shared. And,
exactly.
And information is the key thing in terms of determining what's best for the patient. So that can be a real barrier. I agree with that.
And can I just add one slight comment to that? The one slight comment is, even though there's two-way communication between the pharmacist and the doctor, it's still primarily one way from the physician's office. And I think that needs to change where it is a two-way conversation.
Yeah, particularly with the advent now of shared electronic records. It's all there. All we need to do is put a bridge between the various users. But I appreciate there are much bigger concerns with privacy, etc. Irina, did you wish to make a comment?
Yeah, one
Please.
second. I absolutely agree with everything what say Michael. But I can add one thing. I do this. I train in pharmacists in diabetes. First of all, this is very, very popular subject. Pharmacists won't listen about this because they do not have enough qualification, competence for these skills and these skills. But for maybe best program, this is good. Have influence like emotion, and maybe for start, I don't know. Invite some person who have diabetes and listen what he's thinking about, what they want, listen from pharmacists, and what maybe story. And this is through the emotion, pharmacists will be involved and be understand better people with diabetes. We use this also, and I recognize when I research about which barrier. This is also lack motivation for pharmacists, and we must rise our role as pharmacists in diabetes care as really part of a multidisciplinary group in diabetes care. Thank you.
Thank you, Irina. And I think all of those comments certainly highlight the importance of this practice transformation program. There is so much that the pharmacists can do. They need to be empowered to exercise their maximum influence over progression of diseases such as diabetes. We might quickly now just look at the Q&A, and I see a couple of questions here. The first is from Hind Mawata, how diabetes management can be improved. Well, Hind, I would hope that a number of the questions and responses that we've heard already would address that. You've also asked what possible interventions would you recommend to the patient to help them achieve better glycemic control? That's key to diabetes treatment. Tolu, would you like to maybe just what's the most important intervention that you can recommend to the patient to help them achieve better glycemic control?
Mm-hmm. Thank you very much.
Either the most simple or the, yep.
Yeah, sorry to cut you short. I think if the aim is to achieve better glycemic control, if it's someone who is still in the pre-diabetes stage where it's still glucose intolerance, that is the stage where we can really advocate for, or really encourage physical activity, better choices around diet, and basically a healthy lifestyle, potentially avoiding alcohol and tobacco use. And those are the things that we can push if it's pre-diabetes. But once we have a diagnosis of diabetes already confirmed, at that stage, I think as pharmacists, we must prioritize compliance with medications. Depending on at what stage the person is found, there might be 1, 2, 3, 4 pills that the person has to take at the same time. And there's usually challenge with managing pill burden for a couple of patients. So that we should pay attention to how our patients are coping with the pill burden they now have to handle, and how they are faring in with compliance. Well, I also think that there might be an opportunity to understand how the patient is experiencing diabetes. Depending on where we are from, there are some communities where sicknesses are seen as maybe some form of spiritual warfare. And so rather than accepting that, this is something that a medicine can support a patient to put under control, there might be more inclination to explore prayers and, other spiritual means. So pharmacists are also well placed to understand how patients are living with their diabetes, what are the options they are considering, and guide them appropriately to make sure that they see the opportunity and the value in the medicines that are available to tackle their diabetes. So let's understand how our patients are living with their diabetes. What are the things that are driving compliance or absence of it, and encourage them to tackle them and adopt the evidence-based practices that we're familiar with. Thank you.
Thank you, Tolu. Michael, as someone living with diabetes, what's your tip for people achieving better glycemic control? Is it lifestyle, like glucose monitoring, diet? What are your thoughts?
I could answer everything on that, but for me, I follow a very simple rule, and I keep it onto my hand, which is nutrition, exercise, managing stress, and getting enough sleep. And then the last one is, as just discussed, adherence. And adherence meaning orders and prescriptions that a physician would provide. And I have seen that with myself within my career, where I can see stress levels at such a high level. And these were time periods when I was going through some personal issues. These are the times that actually led up to my DR, led up to open heart surgery, led up to a very tough 2014, 2015 for me. So I think in understanding it from a high level, but the important thing that it is, even though we're talking about the role of the pharmacist, like I said, the pharmacist is still one of the coaches on my team. They're on the sidelines. I'm playing the game every day. I'm the one making the decisions. I am the one who needs to be responsible for what I do. And I have more than enough heard people say, well, that's my doctor's job. Even my own mother comes out and says, my doctor's going to be mad at me. The doctor looks at the numbers, gives you directions. Doesn't mean they don't care. But the thing is, there's 4 of you coming afterwards this afternoon with probably the same issues. So it makes it very difficult when I do hear people overcomplicate this. Now, I said there's a lot going on. There's a lot of things to manage. It's a challenge, but keep it simple, is the best phrase out there. And I do believe, even last night, I did not get enough sleep, and I have my cup of coffee still to the left of me. And that's the thing, is my blood sugar has been under control, which is nice. But after we finish this call, I do then need to take the next steps to make sure my blood sugar is under control until this evening. And there's also a few other steps today. So yeah, I think that's the most important part. And I think it's selling to the point that the diabetes self-management is so key. It is probably the most important thing of anything we can talk about. And the pharmacist is one of those people to help encourage that and to give tools.
Thank you, Michael. Finally, Arena, I'd welcome your thoughts on that as a diabetes expert. What's the one tip to achieve better glycemic control for a diabetic patient?
First of all, this is hard work, and everybody must understand this, because sometimes doctors and even pharmacists can say, you must have high glycemic like this 7 points, but it's very difficult to achieve. Very, very difficult. And I want to say, if not achieve from start, don't be frustrated. Don't disappointed. Many of people who has diabetes have not achieved control, but we must try. And for my personal experience, this is only one way: control diabetes, control, check blood, different methods. DCM, if you have possibility access to modern technology, it's okay. But if you have also only glucometer, it's also a great opportunity to check and try to be in normal level. This is very important. And also, I think it's sometimes people depressed after this, they cannot achieve. Find people, go to community, to diabetes community. You can find people who maybe can motivate you and can share experience with you. And this is positive moments, and to be use every possibility go to and involved to be in diabetes movement. A lot of camp, a lot of events, which you can meet some people who the same like you, and you can teach from them, because peer-to-peer education, peer-to-peer is very, very have a very good result. And I think it's possible, and only need to try it.
Thank you, Irina. And thank you to all our panelists. Thank you to our participants who have provided a number of questions for us. Some really interesting insights there from across the spectrum, from diabetes experts to diabetes sufferers from various parts of the world. So I certainly hope that all of our participants today in the audience took some real value from that very engaging discussion, and I thank you all for that. We'll now move to the next part of our presentation today, and I would just ask for the next slide, if we could, and I would ask the panelists if they might just, yes, thank you. And we're moving now to the launch of the FIP Practice Transformation Program on Diabetes. And it's my great pleasure to introduce two gentlemen. The first is Gonzalo Sousa Pinto, who leads the area of development and transformation of the profession at the International Pharmaceutical Federation, FIP. Through this role, he supports the work of FIP member organisations and individual pharmacists around the world in advancing pharmacy practice and implementing pharmaceutical professional services in the areas of responsible use of medicines, in the prevention and management of non-communicable diseases, as well as infectious diseases, including vaccination services. Our other speaker is Enikan Ekbion. Enikan is a pharmacist from Nigeria, currently working with the International Pharmaceutical Federation as the Practice Transformation Project's coordinator. In this role, he coordinates the One FIP Practice Transformation Program on non-communicable diseases, a program aimed at supporting FIP member organisations to introduce changes to pharmacy practice in response to priority healthcare needs related to cardiovascular diseases, diabetes, asthma, COPD, cancer, mental health, and others. Gentlemen, thank you, and the floor is yours.
Thank you very much, Paul, and hello everyone. A pleasure to be here today. And for us, it's a really special day today at FIP, in which we are sharing with you and with the greater community this practice transformation program on NCDs. And it's a pleasure to present this program together with my colleague, Enikan Ekbion. We will provide you an overview of what this program is about and what it sets out to do. So some background. 3 years ago, the WHO, the World Health Organization, organized the Astana conference on primary healthcare. This was to somehow celebrate the 40th anniversary of the Alma-Ata conference that had launched the basis and prioritized the importance of primary healthcare. And this, by organizing this conference in Astana, in Kazakhstan, in 2018, the WHO relaunched the importance of primary healthcare towards the sustainability of health systems, towards better patient outcomes in the prevention of disease, and in involving and engaging with a multitude of health professionals and healthcare providers in improving and prioritizing primary healthcare. And FIP was an active stakeholder at this meeting and signed up the profession and signed the declaration of Astana on behalf of the pharmacy profession. And this implies a commitment from our profession in various areas of primary healthcare towards the goal of achieving universal health coverage by 2030. And for FIP, this has also meant defining 3 big areas of work that we have been prioritizing and working on. And this includes prevention, and in particular vaccination services. And you may have seen that FIP has been working a lot in this area, but also non-communicable diseases. And this is what this program is about. And then also patient safety. These are 3 important areas of work. And with NCDs, non-communicable diseases, we are launching a program to support the transformation of pharmacy practice. And by transformation, what we mean is that it's a sustained and sustainable change in pharmacy practice to include a series of services addressing the prevention, the screening, the management of non-communicable diseases in a way that they become a normal part of every pharmacist's practice in day to day. And so, but our work on NCDs actually goes back a few years. In 2011, we already launched a publication actually on diabetes. So it's actually almost the 10th anniversary of reviewing and revisiting that publication on diabetes care that we launched 10 years ago, but also publications on mental health, guidelines for supporting pharmacists with addressing some risk factors such as tobacco use. And then later in 2019, we launched this reference paper on beating non-communicable diseases in the community that provided an overview of evidence and interventions by pharmacists in all 5 main areas of NCDs, and also a policy statement that was launched that year. Then we continued to work on that, addressed other risk factors such as air pollution, but also nutrition. In 2021, we launched toolkits for improving medicines use and medicines reconciliation, which are very important in long-term conditions such as non-communicable diseases. We launched the FIP development goals, and this year we started working on this practice transformation program, which we are very happy to present to you today. We have started with diabetes. This year, as you may know, it's the centennial of the discovery of insulin, and also diabetes is one of the most prevalent non-communicable diseases around the world, and growing, as we've seen during the discussion and the data that was presented. So we have prioritized diabetes first, but the aim is to cover the other non-communicable diseases in the next few months and years. So today we are presenting to you the FIP Practice Transformation Program on NCDs. And this is the symbol that you will be seeing on all the publications and resources related to this program at the various disease areas over the next few years. It's a circle that expresses the holistic and an integrated approach, collaborative approach to the management of NCDs across the various health professions, and pharmacy is contributing to it. And it's a circle that combines the 5 colors of these 5 main disease areas. And we're starting with diabetes, and we say. So as it has been highlighted, the aim of this program is to provide tools, but also strategic support to FIP member organizations to develop and implement a series of services by pharmacists and pharmacy teams that can have a sustained impact in the prevention, screening, management, and treatment optimization of diabetes that will lead to improved patient outcomes, but also indirectly to a better efficiency, resilience, and sustainability of health systems. And we will be providing particular focus and resources to our member organizations from low and middle income countries, but all countries and all our organizations are encouraged to implement this project regardless of their income level. I will now hand over to Anyeken for presenting the next few slides.
Thank you so much, Gonzo. So what is the vision of the Practice Transformation Program on diabetes? Like Gonzo have said, we just want to promote the global transformation of pharmacy practice. We want to ensure that there's a quality improvement of services that are delivered to improve patient outcomes. And we also want to be sure and ensure that the quality of life of individuals living with non-communicable diseases, and especially diabetes, is improved. So what is the mission? How are we going to achieve this? We would assist our member organizations in assessing their country's needs for pharmacy services that would help address the burden of NCDs, and in this case, the burden of diabetes. And we know before we can launch an intervention, there is a need for needs analysis to be conducted. So we'll be supporting our member organization in this process of establishing a needs analysis. Apart from that, we'd also provide bespoke training and education support to pharmacists, because we want to ensure that the kind of services that are provided are of quality. And in order to get our pharmacists to a place where they can provide quality services, we want to provide training and educational support. So when we do that, we can now begin to think about the way, we know that through this, that pharmacy services can be transformed. We'd also support FIP member organizations and individual members, so both organizations and individual members, in the implementation of pharmacy services. Gonzo highlighted them: prevention services, treatment optimization services, and programs that will help reduce the burden of NCDs. This program is aligned to the FIP development goals. So the FIP development goals are a key resource to transforming the pharmacy profession in the next decade. And the FIP development goals are aligned to global goals, such as the Sustainable Development Goals. The FIP goals was launched last year, 2020, and they consist of 21 goals. For this program, we've highlighted 12 goals that will help in transforming the profession in the next 10 years. And we've divided that into 3 goals. We have the primary goals, we have the secondary goals, and we have the tertiary goals. In terms of the primary goals, we have goal 7, goal 14, and goal 15. What do we mean by this? What we mean is that we would help advance integrated services through this program. And in this program, we would ensure that pharmacists bring to bear their medicine's expertise in providing quality care to patients. We'd also ensure that people and patients are at the center of the kind of care we will be providing through this program. In terms of the secondary goals, we have goals 11, goals 18, and goals 19. This program will highlight and place importance on positive outcomes, because we believe that when pharmacists are trained and they provide quality services, then we would see quality outcomes. So we place emphasis on impact and outcomes in this program. And through this program, we would ensure that there is access to medicines, devices, and services provided to individuals in the communities that these programs will be launched in. Patient safety is a principle that we would abide by through this program. In terms of the tertiary goals, we have goal 5, goal 12, and goal 21. Through our bespoke training and educational support, we will ensure that the competency development of pharmacists are prioritized. When pharmacists are trained, they can provide quality services. And we'll also ensure that any outcome, any data, any evidence that we gather through the program, we will align with the FIP Global Observatory, where our member organizations can actually obtain evidence for advocacy. And then finally, we believe in sustainability, both social sustainability, program sustainability, and most importantly, environmental sustainability. So these are some of the goals that this program will aim to elicit in its implementation. So what are we going to deliver through this program? We're going to deliver a couple of things. The first will be the publications toolbox. And what do we mean by publications toolbox? We mean that we'll be delivering a couple of publications. And the first thing that will be the diabetes services, a handbook for pharmacists, which will be launched today, the next session. And then we'll also provide a project management and implementation toolkit. This toolkit will be a guideline to help support pharmacists who will be implementing this program on how they can go about to implement this program. Then we'll also be developing guidelines for competency development for pharmacists that will help them deliver diabetes-related roles. The guidelines will be delivered and launched next year, 2022. So this is a visual representation of the publications that we've developed. So the handbook for pharmacists will be launched soon in this event. And then the implementation guidelines and toolkit will be launched soon, but not in this event. And some of the tools that are included in these guidelines include the needs assessment tool for establishing baseline need and a patient information sheet that we can share with patients that will be part of this program. So what are the other key deliverables? We are having a series of digital events, which today culminates in the final event. I'll talk about that in the next slide. We'll also translate the publications to be sure that there is inclusion and diversity and the publication gets to a lot of people. And like I said earlier, there'll be a training course for service development and implementation where we will train pharmacists and pharmacy teams. And most importantly for this program, we are adopting technology where we'll be developing a program application that can be available on the Android platform and on the Apple Store. So the basic idea for this program app is that it can be a one-stop shop for everything everything implementation in this program. So what do I mean by that? What I mean is that we'd have educational content there where pharmacists can access diabetes information and training modules. We'd also use the app to collect data that would be during the implementation phase of this program. We'd also use the app to monitor and evaluate the quality of services the quality of services of this program. And also, it's not just for pharmacists. This app will have a patient-facing aspect where patients are able to log in and have information about diabetes and other non-communicable diseases. Also, patients will be able to track their results after consultation with pharmacists. And then we would also include a tab that will enable patients to communicate with their pharmacist. So it's basically a one-stop shop and ensures that there is access to services for everyone. Then we'll also provide support for local implementation programs and have an annual impact and follow-up reports as part of the deliverables. So the digital events series on diabetes, we developed 5 digital events and we developed in a way to touch all critical aspects of the delivery of diabetes services. So the first program was in October, where we talked about the role of pharmacists in the prevention of diabetes. And then the second event, we talked about the role of pharmacists in disease state management of diabetes and prevention of complications. And then we went to the educational aspect of diabetes care, where we talked about competencies and workforce development strategies. And then we went to the science aspect as well, ensuring that all key aspects of care is covered. We talked about diabetes therapeutics, treatment optimization, and support technology. Today, we've talked a lot about pharmacy practice. So we've been able to cover all key aspects of diabetes care, ensuring that we stick to the vision of this program, which is the transformation of pharmacy practice for an improvement in patient outcomes. Should you have missed any of the programs, we would ask that you view the recordings at events.fip.org. On Sunday is World Diabetes Day, that's November 14. And the theme for this year is access to diabetes care. What a time it is for pharmacists, for FIP to launch the FIP Practice Transformation Program on diabetes. This program is a potent tool to enable us to achieve access to diabetes care. As pharmacists, we are well positioned, we are best equipped, and we are great collaborators to ensure that the vision of the World Diabetes Day celebration is achieved. Thank you.
Thank you, Anyakin. So briefly to describe what will be the phases of the implementation of this program. So we will launch a call for expressions of interest from our member organizations, and that will set the basis for this collaboration at country level. Then we will work with this member organization to assess and define the needs at country level in terms of training, in terms of the pharmaceutical services in the area of diabetes. With this will then be, we will agree on a commitment to transform practice in that country through a formal partnership with this organization, and also involving other relevant stakeholders in the country that need to be involved for the success of this program. Then we will co-design the program at country level together with our member organization in the country, and develop an NCD-ready workforce through training modules that will be based on the identified needs and the program intervention areas. We will then implement all these interventions once the workforce is ready for delivering these services. The interventions will be delivered at the pharmacy level, at the patient level, let's say. And finally, the program also will assess the impact and demonstrate the impact of this program by collecting and analyzing the data from the program implementation. So to conclude, this is, as we mentioned, the practice transformation program on diabetes that we are launching or presenting today, with several other resources that will be launched over the next few months. We'll start with a handbook that describes the interventions and that Lauren will present in a couple of minutes. And then after diabetes, we will work on mental health. So the same framework, the same phases of implementation will apply to mental health, to chronic respiratory diseases, including asthma and COPD, to cancer, and also to cardiovascular diseases. And that will conclude this program. But this conclude the launches of this program. Of course, this will become an ongoing program of FIP. And this brings our presentation to an end. Back to you, Paul. Thank you very much.
Thank you, Gonzo, and thank you, Anikan. That was great, and I'm so very pleased and proud to see this practice transformation program being launched today. It's now my great pleasure to introduce Lauren Bloom. Lauren is the Global Engagement Fellow at the University of North Carolina Eshelman School of Pharmacy, and also serves in a consultant role with FIP. She graduated from Drake University in 2019 with her Doctor of Pharmacy, and then completed a fellowship in Association Management. In the fall, she will be pursuing her Master of Public Health degree, where she will further explore the role of pharmacists and the roles they can play in public health. To launch the Handbook for Pharmacists in this diabetes prevention, screening and management, it's my great pleasure to welcome Lauren Bloom. Lauren.
Thank you so much for the introduction. So as was mentioned today, we are excited to be publishing a new resource for pharmacists, a handbook that talks about diabetes prevention, screening, and management. So with my time today, I am just going to provide a brief overview of why this is such an important topic and how we believe pharmacists can participate in these efforts. So on the next slide, as I'm sure you are all aware, and especially if you've been attending this series of events that Anyakin mentioned, you know that diabetes is a huge global health concern and is one of the fastest growing global health challenges, with the number of adults living with diabetes more than tripling over the last 20 years. As was stated earlier, around 537 million adults are currently living with diabetes, or around 1 in 10 globally. And by 2045, this is estimated to grow to 784 million. And then in this year alone, diabetes and its complications are estimated to have contributed to around 6.7 million deaths, or around 1 death approximately every 5 seconds. So really this data just illustrates how this is why this is such a huge public health problem, and why we really need all hands on deck to help reduce these numbers. And of course, pharmacists need to be a part of these efforts. So what are the opportunities for pharmacists to be involved? We know that we are one of the most trusted and accessible healthcare providers, and that gives us a really great opportunity to play a substantial role in providing diabetes services. And we can really get involved throughout the whole continuum of care. So from promoting healthy lifestyles and preventing diabetes cases from occurring in the first place, to identifying people who may have not been previously diagnosed through screenings, to managing people with diabetes and helping them meet their treatment goals, and then leveraging our medication expertise to provide counseling services to help patients really understand their medications. And with all of this in mind, this is how we went about developing our handbook, with this idea that pharmacists can really be involved in diabetes care from prevention to treatment. So on this slide, you can see the 7 different sections of the handbook, and I'll go into each of them in a little bit more depth. So our first 2 sections are focused on services that can be provided before someone is diagnosed with diabetes. So first we have prevention efforts, and this section really focuses on the importance of promoting healthy lifestyles, including nutrition, physical activity, and really helping people to prevent the development of type 2 diabetes. Our second section is about screening and referral services. So this section discusses how you would go about identifying people who might have diabetes and referring them to care. So we talk about common risk factors, signs and symptoms of diabetes that could make someone more likely to have the condition and might indicate that they need to be screened. And then we also discuss, how do you conduct these blood glucose and HbA1c screenings? What results would indicate that someone needs to be referred to care for further diagnosis, and what factors could potentially confound these results. Then in our next couple sections, we move into roles that pharmacists can play when a patient has diabetes. So medication management is our third section, and this one really covers quite a variety of topics. First, we talk about what factors pharmacists should be assessing in their patients. What is their clinical response to treatment? What opportunities are there to optimize their treatment? Are they experiencing any adverse effects, any issues with dosing, any drug interactions? What are common ways that pharmacists could potentially intervene? Then we talk about how to develop and implement a care plan, including sick day care plans, and then how to monitor and evaluate a care plan. So how do you evaluate clinical parameters such as blood glucose or HbA1c? How does self-monitoring of blood glucose and continuous glucose monitoring play a role in this evaluation of care plans? And then we also discuss the importance of medication adherence and rational use of medications. And then, of course, since we are pharmacists, we have to talk about the common medications that are used to treat diabetes. So in this section, we just provide an overview of these common classes that pharmacists might encounter in practice, with a larger focus on insulin, which includes discussions on proper storage and administration and technologies like insulin pumps. And then in the appendix, we have a really great chart developed by the International Diabetes Federation that really does a great summary of the risks and benefits of these common medications. Next, we move into prevention and management of complications. So we know that there are many complications that can arise in those that have diabetes, and pharmacists need to be aware of these. And they should also be aware of the screening recommendations for these complications so they can be identified before they may progress to something more serious. So in this section, we talk about hypoglycemia, hyperglycemia, including diabetic ketoacidosis. We also talk about more of the longer term complications, some of which were mentioned earlier, diabetic nephropathy, neuropathy, retinopathy, periodontal disease, cardiovascular diseases. And we really provide an overview of what these complications are, how do they develop, and how do we either prevent or address them once they occur. And then our second to last section is about non-pharmacologic management of diabetes. So this section really talks about ways that non-pharmacologic approaches can supplement the care that's already being provided. So we discuss similar topics that are discussed in the prevention section, as the importance of nutrition, physical activity, and tobacco cessation. And then finally, we of course acknowledge that there are a lot of barriers to implementing diabetes services in practice globally. So in this section, we just provide an overview of what these barriers are and some solutions to overcome them. So ultimately, all of these 7 sections together aim to provide a really comprehensive look at how pharmacists can contribute to reducing those high rates of diabetes that we talked about earlier. So in conclusion, pharmacists, of course, play a key role in improving health in their communities and are really ideally positioned and qualified to provide diabetes services ranging from prevention to treatment. And with this toolkit, we really hope to encourage all pharmacists to join these global efforts to address rising rates of diabetes. because there really is this enormous potential to improve public health if these services are integrated into practice worldwide. And then this handbook will be available in the general FIP library of publications, and it will also be available on our new microsite for NCDs, which our next presenter, Ruben, will discuss in more depth. Thank you.
Thank you, Lauren, and thank you for the launch of that handbook. And clearly, what a great resource that will be for pharmacists. So much information and so much help there for pharmacists in supporting patients with diabetes. Thank you very much, Lauren. It's now my pleasure to introduce Ruben Viegas. Ruben is the FIP Practice Development Projects Coordinator. He is a pharmacist from Portugal with a master's degree in exercise and health from the Faculty of Human Kinetics in Lisbon. He is currently enrolled in a PhD program focusing on the promotion of physical activity through pharmacists. He has been involved in different associations and educational activities focusing on the area of public health and pharmacy practice. Ruben will launch today the FIP NCD microsite. Ruben, welcome, and you have the floor.
Thank you very much, Paul. So it's a big pleasure to be here presenting the microsite on NCDs. So FIP has been launching these microsites as a resource hub for that's divided into area teams, so practice areas. In this case, it's the non-communicable diseases. So this microsite will host all the information that relates to this area of the non-communicable diseases. These microsites are also a browsing experience. So it's more resourceful for you to find all the things that you need, for example, on diabetes, on one single space, on one single page. So this is the overview of the website that I'll share with you and we'll walk through very briefly in a moment. But on the next slide, you'll have also the structure. So there's the about page, and then for the 5 main areas that Gonçalo talked about that will also be developed in the next months and years, we'll have diabetes, mental health, chronic respiratory diseases, cancer, and cardiovascular diseases. And in each of these tabs, we have publications related to the topic, the events, and also some partnerships, because of course, going together and working for the same goals is way better than doing it alone. Then you see the arrow that comes from the Practice Transformation Program, because as resources and publications and events are developed in the next years, these will also be collected inside each category. Then you see also on the right side, general resources that are not specific for any NCD, but are more broad. They also have publications, events, and general partnerships. One important thing is that you might find publications that are in different sections, and this is not a mistake. This is on purpose, because we want to make sure that if you look for diabetes, then that you have all the information that relates to diabetes, but there might be a publication that is equally important for diabetes and cardiovascular diseases, so you'll find it in both places and not only in one place. So on the next slide, you'll see the link. So it's ncd.fip.org. It's very easy. And if Gonçalo allows, I'll share my screen briefly and we'll do a very quick tour guide also for the sake of time. Thank you. Here. So I hope you can see it. When you insert ncd.fip.org, you'll see this about page, and it has small description and focuses on goal 15, as Paul mentioned in the beginning. So you have the education, practice, and science elements briefly described. And then you have a timeline of FIP work on NCD that goes back to 2003 with the first papers until recent years with more publications, also policy statements, because they're also important to advance, and then the development goals. And recently, 2021, also a series of publications and the launch that Gonçalo announced. Then if you go to the tab on the main NCD areas, you'll have a drop-down menu for each condition. And this, for example, is diabetes, and you'll have all the publications listed here. And if you click on the events, all the events, for example, this is the series that Anieka presented. Then, of course, you have the partnerships aspect. So this will be the same for all the areas. This is the mental health aspect, the chronic respiratory conditions. I'm not going to go through all for the sake of time, but you'll be able to explore it further. And then the cardiovascular diseases as well. So moving to the general resources, you'll also see the same structure. You just also have a reference to the groups and networks that also work on the area of NCDs. And lastly, everything that is related to the practice transformation program is also here. So you can see all the publications, events, and partnerships as well. And I think that was it. We hope that you enjoy, and that if you have any research interest or any specific interest in any of these areas, that you'll find the resources easily and in this area. Thank you very much. Back to you, Paul.
Thank you so much, Ruben. And again, just a fabulous resource for member organisations and pharmacists. So I guess now we'll wrap up today with a brief summary of what we've seen. The panel discussion, which looked at the contribution of pharmacists to achieving global diabetes goals. Thank you so much to Irina, Tolu, and Michael for your contribution, your expert views, and your tips for pharmacists imparting their knowledge and the ability that they can exercise in providing better healthcare outcomes for patients with diabetes. Clearly, pharmacists are the best professioned healthcare professionals to intervene, support, and educate patients to improve those outcomes from people suffering with diabetes. We had a number of interactions from the participants from the audience with some questions, and I thank you for those. We then had the launch of the FIP Practice Transformation Program on Diabetes, which is the culmination of months of work from Anieka and Ruben and Gonzo. And I thank you so much for your contribution. And we've seen in that framework you've shown tonight what a valuable program this will be. And in fact, this will progress to a number of other NCDs, and that template will be most useful in addressing each of those different disease states. Then thank you to Lauren for the launch of the Diabetes Prevention, Screening and Management Handbook for Pharmacists. Again, a tremendous resource, one that every pharmacist can use and will get significant value from. And finally, for Ruben, the FIP NCD microsite, a huge resource, a vault of information, and something that will add enormous value to this program. So in just thanking the panelists again for your contribution, a particular thank you to Gonzo, Anieka, and Ruben for your work in developing the program. I would remind all the people in the audience tonight that the recording of this webinar will be available at fip.org. We would welcome your feedback, which you can send to webinars@fip.org. And again, I would thank you all for your participation and your attendance, and wish you a very happy day for the balance of the day. Thank you so much.
Thank you, everyone. Bye-bye.
Thank you, Paul, for moderation. Thank you, team.
Thank you, Irina.
Thanks, everyone. Bye.
Thank you, everyone. Goodbye.
Thank you, Lauren.
Have a nice evening.
Bye-bye.
Bye-bye all.
Yeah.
Thank you.